My name is Ashley Amalfi. I am a board-certified plastic surgeon at the Quatella Center for Plastic Surgery in Rochester, New York. And I'm so excited to talk to you guys today about an article that really means a lot to you, because the whole purpose of this article is to look at how well we are delivering information about cosmetic injectables and fillers to all of you, our patients. And this study really looks at how we are doing and the quality of information on websites versus the quality of information in video on YouTube. And ideally, you guys want information that's delivered to you by the doctor, because as plastic surgeons, as board-certified plastic surgeons, we are the experts on what can we deliver and how do we do that safely. And as patients, you guys are looking to all of us to give you real information. And traditionally, that was all done on websites. So for me, patients used to go to the website to read about procedures, to look at before and after pictures. But in the last few years, that's really changed, and social media has really changed the way we look and receive information. And so for my patients, they are all following along on Instagram, because that's real time. It seems to be the most updated way to get information. It allows our patients to have just a little bit of a behind the scenes look as what we're doing as doctors. And so for the patient, there's a nice sense of familiarity, and video is really king. So patients are wanting to hear from us. They're wanting to hear from the plastic surgeons, the experts in these topics. And so everything has sort of turned to video. And as a population, myself included, I'd much rather sit and listen to someone explain something to me in a video than I would go and research and read about it. It's just become such an easy way to get good information, but not everything out there is good. And I'm just as guilty as everyone else for really loving video and making video such a priority. If you look at adults, 70% of adults are using YouTube right now. And if you look at a younger generation, so patients or the public 15 to 25, 81% of you guys are using YouTube. And so that's really where this is all going. I use YouTube for everything. I mean, I couldn't get my kids' car seats unhooked out of the car, and it was so much simpler to just look up a quick YouTube video on how to do it and get that information, get good information, and get it fast. But I think that's sort of the point of this study, is we really need quality. And so what the authors found is that the quality on our websites is actually better than the quality of the information we're delivering via YouTube. And so as plastic surgeons, we need to do a better job of educating all of you, because that's really what we want. We want you, our patients, the public, the consumers, to have good quality information. We want you to know what to expect, how to find a safe doctor, what is realistic and what is not realistic when it comes to not just plastic surgery, but specifically injectable fillers. So what can we do in a non-invasive way to improve facial aesthetics? And so the take home of this is that we need to do a better job educating all of you. We need to increase the quality of what's out there on YouTube and include more video and more YouTube video on our websites to tell you just what we can do and how we can do it safely. Because when a patient comes to the office and they're educated, they understand, they have realistic expectations, it just makes everything go smoother. And having an educated patient is the absolute best way for us as plastic surgeons to deliver quality and safe results to all of you, our patients and the public. So I encourage you all to read this study. It's really important, and it is an important turning point for plastic surgery and our interaction with all of you, and we vow to continue to do a better job to bring you quality information both on our websites and most importantly in video.